Hey everybody, welcome to this month's question of the month. As you know, you can give us your own question by going to yoganatomy.com/myquestion. Write it in there, submit it, we'll review it, and if we can, we'll get it onto video for you. So this month's question comes from Terry, who I know Terry. Hey Terry. Hi David, I'm 6 weeks post meniscus tear injury, not from yoga, she emphasizes with an exclamation mark. What do you feel is the best way to modify triang mukhaikapada paschimottanasana while my knee continues to heal? Besides elevating the hips a lot and slowly working to flexing the bad knee back to as close to the position without, of course, causing any pain, just wondering if there might be another way to start working towards the pose without actually doing it. It's a good question, Terry. So good to hear from you, and sorry to hear about the meniscus tear. You're already obviously reducing the amount of flexion that you're putting in. I would guess, you didn't specify, but probably sitting up on a block or something like that. I mean, that is the simplest, easiest way to progress. The other thing you might consider, which is maybe a little bit outside of practice, but you can do it in that moment, is to actively flex the knee without weight on it. Maybe you lay back for a second and you, using your own muscles, kind of pull your foot in and your knee in just to make sure you're working with the muscles as well, if you're not doing that already, of course, outside of practice. The other thing you can consider, and I would say, as you progress lower on the blocks, again, I'm assuming that that's what you're doing, something along those lines. As you progress down, you might keep a towel in the back of that knee for a while, just to make sure there's space there. The other thing to do is to test the rotation of the knee. There are some situations where the external rotation at the knee itself is helpful and creates space, but that also assumes, and I don't know based on your question, I don't have the details of what happened to you, it assumes that the tear itself is in the posterior and medial meniscus, and in those cases you want to kind of open up the inside of the knee a little bit. So you might actually try to do a little bit of rotation even while you've got your hips up on a block or something like that, or a bolster, whatever it is. You might try turning the foot out a little bit. Be really careful with that. Obviously you would go just a little bit and test to see what that feels like. And again, it assumes where that is. Other than that, there's not much else you can do and try to do that posture. You might do it with both legs so that you're getting a little bit of support from the other side instead of doing it as a one-sided thing, which tilts you off and or puts force into that one knee by itself and at an angle. So just be careful about those couple of things. I hope that helps. Anyway, if anybody else has a question, go to yoganatomy.com/myquestion and we'll try to answer it on video.